Pituitary Gigantism by Daniel Pruckler. Pituitary gigantism is a very rare disorder that occurs during childhood, which causes extreme bone, muscle, and organ growth. Gigantism is caused by an overproduction of growth hormone that occurs before a child's bone growth plates have closed. This results in excessive growth and abnormally tall height. People with gigantism generally have very large hands, fingers, toes, and heads. Some characteristics include coarse skin, excessive sweat production, and a very deep voice. They may have enlarged internal organs such as heart, kidneys, and liver. This can cause complications with the body including hypertension, severe headaches, sleep apnea, diabetes, and heart failure. Due to their abnormal size, oxygenation is difficult and they are easily fatigued. The causes are because of overproduction of growth hormone. Diseases, disorders, and conditions that cause growth hormone overproduction leading to gigantism include Bain tumors of the pituitary gland, Carney complex, McCune-Albright syndrome, multiple endocrine neoplasia type 1, and neurofibromatosis. Growth hormone has an effect on all body tissues. It affects growth and development of organs, skeletal muscles, and bones. Children are very tall for their age and may also have the following conditions: enlarged hands, fingers, toes, head, and tongue, excessive sweat production and headaches, irregular menstrual periods in teens, late onset of puberty, large jaw, prominent forehead, and thick facial features. Weakness and tingling in the arms and legs due to enlarging tissues compressing the nerves. Most giants have the brain size of an average adult. The excess growth hormone makes the walls of the skull grow thicker and sturdier. The brain's cavity stays the same size as an average adult. This leaves the function of the brain in giants unaffected. Giants may develop big muscles, but they are not always as brawny as they look. In gigantism, excess growth hormones means excess salt in the muscle tissue, which makes the tissue swell up with water. The muscles are larger, but they are not stronger. Cells on the side of the bone grow faster than the other side, which causes the bone to curve. Muscles end up like rubber bands that are too long, which makes the muscles weak. Risk of complications of gigantism can be reduced with early diagnosis and treatment. Regular medical care greatly reduces the risk of growth hormone complications. Untreated conditions can lead to problems with the extremities. The man standing to the left is Robert Wadlow. He is the tallest person in history for whom there is irrefutable evidence. Here's a chart that shows the rapid growth of the disorder. At age 8, Robert was already 6 feet tall. By age 18, he was already past 8 feet. Acromegaly is a more common disorder that is grouped with gigantism. This disorder also causes an overproduction of growth hormone and shares many of the same signs and symptoms. The only difference is the overproduction of growth hormone in acromegaly occurs in adulthood after the bone growth plates have closed. Most cases occur to people in their 30s or 40s. This does not result in the same extreme growth as with gigantism, but will still show large characteristics. Andre the Giant was a famous pro wrestler who suffered from acromegaly. He refused treatment for his disorder and as a result died from heart failure while he was sleeping a year after his retirement. Many complications can arise if pituitary gigantism is left untreated. Excessive growth at an early age is a good indicator of this disorder. Complications include diabetes and other endocrine disturbances, diminished vision or total vision loss, hypothyroidism, severe chronic headaches, sleep apnea. In addition, they may also face embarrassment, isolation, difficulties with relationships, and other social problems. Risk of complications of gigantism can be reduced with early diagnosis and treatment. These treatments include surgical removal of the pituitary adenoma, radiation of the adenoma to reduce tumor size, drug therapy including medications that reduce growth hormone release, block the effects of growth hormone, or prevent growth and stature, and surgical removal of the pituitary. Pituitary surgery is usually successful in limiting growth hormone production. Early treatment can reverse many of the changes caused by excess growth hormone production. 80% of gigantism cases are cured with surgery. After treatment, most children live long and fulfilling lives.